Come on, have you seen this video? Come on, what's wrong? What's wrong, come on? I think this might be a heart attack. Let me call a heart attack center at Roman Catholic Hospital.
Good day. You've reached Roman Catholic Hospital heart attack.
Hello, is this a heart attack center? I think my friend is having a heart attack.
Hello, sir. I need you to stay calm. Can you tell me what your friend is complaining about? What do you see?
Chest pain, difficulty in breathing and he's sweating a lot.
Okay, sir. Your friend has to get to the Roman Catholic Hospital emergency unit as soon as possible. Check on his phone if he has the EMET panic button.
Okay. I'm checking this. Yes, what should I do?
I need you to press the panic button to activate the EMET rescue ambulance.
Okay, I'll press the button.
Sir, I need you to do something for me. I need you to stay with your friend and make sure that he stays awake. Thank you for contacting the Roman Catholic Hospital Heart Attack Center.
So, Mr. Kambonde, yes. I've noticed on the ECG, it seems to me that you're having a heart attack, yeah? I'm just going to ask you a few questions before I give you something for the pain, yeah? When did the pain start? This morning?
Yes.
Okay. Is the pain radiating to your left arm?
Yes.
Okay. When you lie down still, does the pain go away or not? It doesn't go away.
Yes.
Okay. Were you lying down or walking around when the pain started?
The office.
We're in the office. From a scale of 0 to 10, yeah? 10 being the worst, 0 being the least. How much is the pain now?
10.
Okay. Mr. Kambonde, are you allergic to any medication?
No.
Are you using any medication?
No.
Is this the first time you're feeling like this?
Yes.
Do you have any sugar problems?
No.
Nothing. So I'm going to give you some morphine. Do you have any allergies to morphine?
No.
Okay, I'll give you the morphine. You must just tell me if you feel any nausea or feel like vomiting or anything, eh? Name Mr. Kambonde. Okay. Right, I'm drawing up morphine, 15 milligrams.
I know.
Okay, Mr. Kambonde, I'm going to give you the morphine now. Just tell me if it's burning when I'm injecting it, ne? Okay, right. Morphine 5 milligrams at 9:20. Okay, 5 milligrams morphine in. Okay, Mr. Kambonde, we just give it a few minutes to let it work. You just need to calm down and let it take its course, ne? The more you go on, the more strain you put on your heart. I'm just gonna listen to your chest quickly. Okay, Mr. Kambonde, the morphine is going to take about 3 to 4 minutes, sometimes 5 minutes, just to get it working, ne? But now tell me, after I give you the morphine, do you feel nausea? No feeling like vomiting, ne?
No.
So let's let call center know that we are on our way, ne? To Roman Catholic. Okay, Mr. Kambonde, we're gonna take you to Roman Catholic. Is that fine with you? Okay. Charlie, Romeo 1. Okay, we have a 43-year-old male patient. We are suspecting a MI, myocardial infarction. We are going to Roman Catholic Hospital. Patient is priority 1. Suspected MI, ECG findings and positive OPQRST. Please inform Roman Catholic to activate the heart attack center. Thank you. Okay, pride GCS is now currently 14, chest is clear. Mr. Kambonde, how is the pain now? From 0 to 10, 10 being the worst and 0 the least after the morphine now?
5.
Is it 5? So it's getting better. Okay, do you feel any shortness of breath? Any difficulty in breathing? Nothing. Okay, are you comfortable?
Yes.
Okay, so we'll monitor you the whole way. Just tell me if you're feeling worse, if you need oxygen, anything. I'm here for you, ne? Okay. Okay, all the lines are clear, everything is clear. Morning, how are you?
We're fine. How are you?
Mr. Kambonde, 33-year-old, we're suspecting an inferior myocardial infarct. ST elevation in leads 2, 3 and AVF. He said the pain was unprovoked. Onset was this morning, radiating to the left arm with a severity of 10 out of 10. I gave him some morphine, 5 milligrams, after which the pain is reduced to 5 out of 10. Gave him some aspirin and clopidogrel. He didn't require any oxygen. We have a normal saline 1000 ml running. It was just to keep the vein open. Otherwise, his vitals were now stable. It's just the ongoing chest pain that is still continuing. Yes.
So you gave the clopidogrel already?
Yes.
How many milligrams?
We gave 300 clopidogrel and 300 aspirin, and then the 5 milligrams of morphine. I didn't give any GTN.
Okay. Sister, can we move into another bed?
Yeah, just take your time.
Slowly.
Just take your time, take your time. Alright,
Sister Agatha, he got 300 of clopidogrel. Can we give him another 300 on top of that? Can we mix up a morphine, please? Titrate it and give him 2 ml. And then give him sublingual nitrate. Let's repeat the 12-lead ECG and put on our monitor. Mr. Kambode, I'm Dr. Shibute. I'll be assisting you today. So what seems to be the problem exactly, sir? You have chest pain. Since when?
I've been in the office.
At the office today. Can you remember what time, how many hours ago did the pain start? You can't remember. Okay, but it only started today. Where exactly is the pain? In your chest. Can you show me just one finger? Where exactly is the pain? Do you have any medical condition that you take medication for on a daily basis? Blood pressure medication. Okay. Give him 300 clopidogrel because Imed already gave him 200. Give him sublingual TNT, 2 puffs please. And then can you please titrate up morphine for him? Sister Desiree, we please need to do bloods, okay, for cardiac markers and
Just under your tongue, 1 puff.
okay, and just do a D-diamond as well.
Can swallow. Okay.
Mr. Kambode, do you feel nauseous? Do you feel like you want to vomit? Okay, he's also sweating a bit. Sister, once you give the morphine, can we also just connect the ECG and do the ECG for him? It's a 12-lead.
Okay. Morphine titrated. 9 ml of normal saline, 10 ml.
Okay, give him 2 ml, please.
2 ml. Running.
Okay, his saturation has improved. Mr. Kambode, the pain will start to get better. Okay, you got something for the pain. It should get better. If it's not getting any better, please let us know so we can give you more medication. Let me just see. Okay, the ECG, he's got inferior and anterior changes. He does seem to have an inferior and an anterior ST elevation. From the looks of it, Mr. Kambode, you look like you are having a heart attack. Okay, so that's usually when one of your arteries in your heart becomes blocked. Okay, so what we need to do is I'll call the cardiologist, Dr. Beshir, and just inform you about you so that you might need to go to what we call an angiogram. Okay, so an angiogram is a procedure whereby they will go into one of your arteries, either your groin or on the wrist, just to check if there's any blockage on the arteries of your heart. At the moment, I think you are having a heart attack. I will just call him and inform him, okay?
Is the pain a little bit better now after the injection? Getting better? Okay. Just take a deep breath and relax. Okay?
Dr. Beshir, this is Dr. Shinta. I'm calling from Casualty Roman Catholic. I have a 46-year-old male hypertensive with high cholesterol. He presented with a 1-day history of severe chest pain, ECG, ST elevation, anterior and inferior leads, and he's got possible proteins of about 5,000. Yes, doctor. We'll bring him up now. We're just getting ready.
So is everything still okay, Nick? Okay.
Alright, people, let's see what we have got. Hello, sir. Good afternoon. How are you now? Are you still in pain? Okay, so what is
6-year-old male hypertensive, dyslipidemia, chest pain since this afternoon. I can't remember exactly the same time.
Alright.
We gave him clopidogrel 300 and aspirin. We just loaded the 300 and gave him something for pain, sublingual TNT and morphine.
All right.
Throat tests were 5,000. We did them in the casualty, and the rest of the bloods went to the.
Okay.
Here's the ECG. Seems to have anterior inferior chain.
Okay. All right. Okay. So what we're gonna do? One of your heart arteries is trying to block or blocked. Okay. That's what's causing a heart attack. So what we're gonna do now? We're gonna take you into our room, operating room. Put a small cannula in the artery in the wrist on your groin, and from there we're gonna open your artery with balloon and stent. Okay. So I know you're suffering now, so we're not gonna talk anymore. We're gonna take you in and start the procedure. All right? Okay, sir. All right, let's go.
Okay, sir.
Okay, sir. So let's see if we can find some blocked artery in you. So now it's gonna be a little bit of pain in the wrist here. This is the local anesthetic coming in. Now we have to wait a little bit for this to work. Gauze, please. All right. Now we're gonna put that small cannula into the artery in your wrist now. It's gonna feel a bit of a pressure here in the wrist. Okay, it may be a bit uncomfortable. And now I'm going to give some medication into the artery. This is to open the artery for me so I can get through. And it is going to be a little bit burning sensation here in the wrist. When we are taking pictures of your arteries, you might feel a little bit of hot flush from time to time in the chest, but most people feel nothing.
107/62.
Okay. So there is a little bit of narrowing in one of the arteries that we have to check with a special ultrasound camera. Then we decide if we need to do something in the artery.
Nitrate 500, heparin 4,000. Thank you, Richie.
So we're gonna have to put probably 2 stents in your arteries. I would say 3 by 20 plus stent for that area, and then 3.5 short for that area. And we are out. There, and the other ball key as well. More in. There's on that. That's it. 59%. Okay, just save it and then go further down in the artery. Biometrics. Just the place that we need to cover is here. Down.
18 seconds.
Okay, now we are taking everything out of your arm.
189/84. Thank you.
You're gonna feel again something pulling through your arm. Now it's done. Finished. So we put 2 stents into your artery on the left side. Okay, one in the middle, the other one at the beginning of the artery. So we look into the artery with a special camera. So there was quite a narrowing in the upper part of the artery, about 60%, and further down there was another narrowing. So we opened both of them with the stents, and the rest will be for tablets now. Okay. So now we're going to take this cannula out of your arm and to put a small balloon here to prevent bleeding from here, and then after a few hours we take it off you, and then you'll be free. Okay.
And this needle I can take out.
The needle is already out.
Ah.
Yeah. Okay, Richie.
So you will not go back to the room that you came from. You will go to the ICU just for close observation till tomorrow morning.
Good day, Mrs. Kambonde.
Good day, ma'am.
Welcome here.
Thank
Doctor
you.
is still busy in theatre. He will be out shortly. Then he will explain to you everything that happened during the procedure, okay?
Okay.
Can we put your bag down here and then we just make you comfortable? Doctor will be here shortly.
All right. Thank you, ma'am.
Hello, Madam Kambonde. How are you?
Fine,
I'm Dr. Beshir, pleased to meet you. Please take a seat.
Thank you.
So I just want to explain to you now what we did to him. He actually came with a heart attack. He was developing the heart attack. Okay. So he had a heart attack because one of his arteries, actually the main one, which is ending here, but it should go on all around the heart. It's a big artery, and it blocked by blood clot and by the narrowing caused by the cholesterol. So what we did, I'll try to show you what we did on his heart. We just put a wire down the artery here. Let me just find the one that's the best for that. Okay, this one. Now the wire is going through the artery. You have an idea where the artery should be, but it's still missing because there's still blockage here. And then we used the balloons. We actually use a catheter to suck the clot out of the artery, and then we pre-open the artery with a small balloon. And after that, you can see the artery starting to come down, and then we put a stent. So now you're gonna see that stent is going to be implanted, deployed. This is when we opening the stent, putting the stent in the artery. Now he came in time, fortunately. So I don't think that it's going to be any lasting damage to his heart muscle, but there will be a little bit of weakness of the heart muscle which is supplied to this artery. But that with the medication that he's going to get from us is going to hopefully improve over the next few weeks to months.
What could have caused it, doctor? Because my husband is a healthy person, he's not sick.
But this is quite typical. Most people who develop a heart attack, they never had any symptoms before. That's why it's such a dangerous disease. It is caused by cholesterol and other substances that are gradually blocking the artery, gradually narrowing the artery. But the final step is that the surface of the artery ruptures and the blood clots in that spot. And then the clot is the final blow that blocks the artery. In many patients it goes completely unnoticed until this happens. Some people have chest pains before or shortness of breath, but he didn't complain about any of those. But maybe when we ask him now, he will recall that he might have felt something before the heart attack happened.
Okay, so the part that when must he come back for you to remove? You said you put something inside, like when must he come back for you to be removed?
It's a metallic tube called a stent. That thing will stay in forever. It's a metallic scaffolding which will then be covered by the scar tissue and will become part of the artery and it will stay there forever. So you don't have to worry. It doesn't rust, doesn't move, doesn't have to be removed.
But can he still like fly or?
Yeah. We will keep him. We will keep him in hospital for say 2 days, 48 hours. After that, he will go home. He'll take his tablets. He will start a rehabilitation program, and then he will go back to his normal life. But he must change his lifestyle now. No smoking. Ideally, a good diet also as well. Plant-based diet, lots of vegetables, and avoiding carbohydrates, sugars, and bad fat also. Okay. But we will give dietitian advice as well later on at Beshir Hospital. Okay. So now you just you'll see him outside. He's fine. The pain is gone, and you talk to him and don't cry. Okay.
Thank you so much for saving my husband.
You're most welcome. You're most welcome.
Yes.
Hi, Sister Maggie.
Hi, Vali.
Here we have Mr. Kambonen Dianale, for 3 years old, patient of Dr. Beshir, who suffered heart attack while at work. He was then rushed into our emergency unit by EMED rescue ambulance, where he received his emergency treatment for heart attack. He was then brought to cath lab, where we did coronary angiogram. We worked through the right arm and we suck out the clot in LAD and stent the proximal part with one stent. Medication given during the procedure, we gave Rehnocaine 1% to numb the area, Domicam 2 mg to calm down the patient, atropine 1 mg, phenylephrine 200 microgram was given, morphine 5 mg was given, as well as heparin 10,000 unit. Second plasmacytometry is running in. There was no complication throughout the procedure. Vital signs during the procedure were normal, no hematoma and bleeding observed from the arm. Patient appeared to be clinical stable.
Good morning, Mr. Kamponte. My name is Sister Margaret. Welcome to the Roman Catholic Hospital ICU. Thank you. I'm going to connect you to the monitor. Going to check your heart rate, your blood pressure, your saturation meaning the percentage of oxygen in your blood. Then I'm going to give you the ringing balls. Here is it. You press here at the red if you need me, if I'm not around. But most of the time I will be around you. I'm going to provide you with urinary bottle in case you want to pass urine. You can use this. If you want to pass urine, you can use it. If I'm not here, please don't stand up. Ask me first. Then I have to check, or actually I have to deflate every 10 minutes. I have to check whether there's bleeding here. Please don't move this arm for 2 hours. And then if there's no bleeding or any complication, you will be discharged home.